Mike Knight is with People's Health, and he's with us now to talk about a few things. First of all, who needs Medicare?
Well, if you're 65 or over, you probably should have it if you don't have it already. Yeah. Even people on disability, if they have been on disability for 2 years or more, on Social Security disability, they would qualify for Medicare. And that helps them out because it's really hard if you're on disability to get any other kinds of insurance.
Do you help people who are on Medicaid?
We do.
Okay.
So, but you do need to have both Medicare and Medicaid to qualify. For some of our plans, they're called DSNP or Dual Special Needs Plans.
Okay. I need to check with you because, to be honest with you, I'm not really happy with where I am in my life with all this, and I need to check that out. So I'm glad to be here, and I'm gonna be glad to talk to you about this. It's very difficult to get information, and that's why I love the fact that you've got like an office, you've got a building. I mean, people can walk in here and ask questions because, sometimes you're online and I don't know, you're on the phone, you're online. I get lost online quite often, so it's great that there is a location for people to stop by, and it's right here in Metairie, Veterans in Clearview. Yeah, I'm sorry, Veterans in Causeway.
Yeah, and the nice thing about it is that you can come get true information, not someone's opinion, and we can explain it in a way that's most important to you. So if you come in and say, this is what's important, we can say, look, this is what you need to do, or this is what you need to consider. Here's the things you need to think about.
Mike, I've been talking about baby boomers and how, our generation, in a lot of ways, redefines what it means to be old. In fact, we don't even like to say old. Instead of seniors, it's easier to call us just, boomers. We have, as a generation, we have collectively cared about our health over the years, from when we were younger to today, and a lot of people in our generation have been very health conscious. But you still need to have insurance. But don't you find that as a generation, a lot of baby boomers are still at a later age? They're still relatively healthy.
Oh yeah, without a doubt. I mean, there's people I run into today. Two of them came in today. One was 73, and I thought he was just becoming eligible for Medicare. So you do have a generation that is more active, which is good. It extends your health, and it helps you, once you get into Medicare age.
Yeah. All right. So, so you can help people sign up with Medicare and Medicaid. You can help them with that, and then they become eligible for People's Health.
We can give them the number or how to go sign up for that.
Okay.
And then once they do have their Medicare and their Medicaid, then we can help them with health plans that will give them other benefits.
Yeah. So, I mean, if you're confused about this, come into People's Health, Veterans, and ask them to, because sometimes, I don't know about you, but for me, rather than call somebody or go online, I do better talking to somebody. So you can help steer them you can give them the 1, 2, 3, 4 things that they need to do to become eligible for Medicaid or Medicare, and then they can become eligible for the supplement of People's Health.
Yeah, we'd be happy to give them a roadmap for what to do, what steps to take, where to go first, second, and third, like you said. And that just gives them direction. And, right. I mean, they can stop in here. There's no obligation. We're more than happy to just give them information because there is a real need for it out there.
Well, I can tell you, what I went through. Yeah, there's definitely a need for it. I wish I would have known about you, but again, I'm going to seriously talk to somebody after I get off the air here. How are the premium, the cost? How the premiums?
Okay, so with the People's Health plans, there are no premiums, but you do pay for your Medicare Part B. If you're in a dual special needs plan, those premiums are usually going to be paid by the state through the Medicaid program. And so there's a couple of different levels of Medicaid eligibility that they would qualify for. And that's on an individual basis based on the income and the assets that they have, and that's determined by the state of Louisiana.
So you don't charge a specific premium for People's Health?
Not at all. It's a zero premium.
So how do you make money?
We're paid by Medicare through a contract with Medicare.
Okay, I see. So this is a government set up with the government that you're on Medicare, but this is an added addition that Medicare's paying for.
Correct, right. We have a contract with Medicare to provide health care services to anyone that wants to join our plan, and we get paid by Medicare to do that.
Okay, so again, it's People's Health Medicare Center, Veterans in Causeway, right next to Trader Joe's, and Party City. I don't know what the specific address is, but I mean everybody kind of knows where.
3017 Veterans.
3017 Veterans. Okay, 3017 Vets. But yeah, I mean everybody knows Trader Joe's and
Party City. Yeah. If you find Party City, we just walk right next door.
Yeah, look, you come to get for your grandkids, you're coming to have a Halloween party, get some stuff over there. Well, just come a little early and stop over here. I mean, don't go over there and put on some kind of a Halloween costume and then come over here. But, come over here while you're in the area. What is the most misunderstood thing about Medicaid, Medicare?
So with Medicaid, a lot of times people don't know they have some form of Medicaid. I would say that's probably the most understood thing. When people go on to Medicare, a lot of times the state of Louisiana will approve them for Medicaid either because they've had a medical condition and a doctor's office has helped them apply for it. But they get a letter in the mail. The letter doesn't make sense, so they stick it in a drawer. And then a couple of years later, they'll come talk to us, and we'll be looking up information to see what they qualify for. And we'll find out, hey, you're eligible for one of these special needs plans that we have where they can get food, they can get over-the-counter. Starting next year, they can get their utility bills. They can use some of those things to pay for. And it just really helps them out with managing their cost every month.
Is all of this much less expensive than paying through your office or your corporate health care plan?
It's going to depend on the plan, and that's one of those things where they should really come in and talk to us.
Yeah.
So that would be our regular Medicare plans. If they're still working, we can sit down with them and see. If they have big deductibles with their insurance and they're Medicare eligible, we can look and see if it might be better if they're on a plan with us and not on that group plan. But there's other things to consider, like if they have spouses covered.
So if you have health insurance with your work, this might be, and you're 65, this might be less expensive for you.
It's for many people, it is.
Yeah. So, and it's a great way to fight inflation,
Oh, absolutely.
I mean,
you
saving money on this.
Right. The premiums you pay, the deductibles that they might be facing, and then a lot of times even their co-payments. Just going to doctors are less here with people's health than they would be with their group plan.
What about pre-existing conditions?
We must cover any conditions that Medicare would cover. We cannot exclude for anything. So if it's a health care procedure or something that Medicare would cover, it's a health condition, we must cover it as well.
Okay. All right, I got to take a break here. You want to hang on for just a few minutes? All right. If you want to join us with your comments this afternoon, the Oakland Heart Jewelers Talk and Text line, 504-260-1870. Every once in a while this show, does something to actually bring you vital information. And this is one of those moments where at People's Health Medicare Center in Metairie, Vets and Causeway, it's 3017 Vets, and you can stop in any time and get information. But I want to continue to talk about baby boomers and what they have contributed to pop culture. You think we've missed anything? Also get back to Ian Hoke and some of your text messages. The Oakland Heart Jewelers Talk and Text line is 504-260-1870. I'm waiting for Ian to get free here in just a moment. He's on the phone, but you can answer some text questions.
Yeah, I'd be happy to.
Okay. All right, Ian, you got some text questions for Mike Knight.
Yeah. Hey, nice to speak with you, Mike. On the Oakland Art Jewelers Talking Text line, here's a question that says, ask your guest about people who are 65 years of age or older and are still working full-time with health insurance coverage. I have been told as long as I have insurance with an employer, I do not have to sign up for Medicare without any penalties.
You've been told correct. So you definitely want to make sure that you maintain that group coverage up until the time that you're ready to retire, and then you can go for Medicare Part B without penalty.
Excellent. Here's another text that asks, if I chose People's Health as my Medicare plan, would I be able to go to a hospital if needed when I visit family in another state? Thank you. Oh, and sorry, I want to clarify. They've also added, I'm 66 and currently covered through my work insurance.
Okay, so yes, you would have coverage nationwide for emergency and urgent care anywhere you travel. We do also cover you worldwide if you're traveling with emergency and urgent care.
Great. And here's another question that says, are there any parishes in Louisiana that People's Choice is not accepted?
No longer. We cover all the parishes. We have at least one plan in every parish in Louisiana.
Okay, great. This did not come off the text line, but it's something I'm just curious about myself, if you'll allow it. Why aren't there more places like People's Health where people can go and ask questions to a real-life human being in a one-on-one setting about complicated issues like health insurance. It seems like such a no-brainer to me, but it's so special that you guys offer this service. I don't understand why everybody doesn't try to do this.
Yeah, that's kind of a loaded question, but we're definitely happy to provide that service. That's the biggest thing, is getting the information that you need to make the right decisions for your health care.
All right, Ian,
Thank
thanks. You. Mike, that's when I first heard that we were doing the show from here. I'm thinking, okay, wait a minute. So it's People's Health Medicare Center. I mean, I have no concept of a Medicare center. So this is really a special thing because it's 2022, and you could come in and talk to somebody, and you don't have to go online. You don't have to just get on the phone. That you can see somebody, and interaction is really sometimes important in getting information.
Yeah, this really helps because, as you said, most people would prefer to do things face to face. We can handle it by phone. We can handle it over the internet. But if you have questions and you need answers, come sit down with us.
Yeah, and look, wherever you live, I mean, this is basically Causeway and Veterans. You can get off the interstate from either east or west, and, you're almost right here.
Correct.
So stop by. Is there anything else you want to make sure that we let people know?
Well, a couple of things. So there are some programs out there. If people are having trouble meeting their bills, there's the Medicare Savings Program, which is a program through Louisiana, the state of Louisiana Medicaid, that they can call and apply for. If people are having trouble with medicine costs, there's a program called Extra Help, also known as a limited income subsidy, that you can call and apply for with Social Security. There is income and asset limits, but it's ways that many people don't know these programs are available that they can help with their costs if they're having trouble. They can come in and we can give them those numbers and see if they qualify.
Now, Mike, do you have vision and dental plans?
All of our plans, well, not standalone, but all of our Medicare Advantage plans do cover vision. They cover dental. We have over-the-counter benefits. We cover gym memberships. So there's a lot of other things just besides healthcare that we provide.
Okay, and then what about hearing?
Hearing, I'm sorry, yeah, we do have hearing as well. So
because a lot of people have been going to concerts and their
talking
ears,
about the concerts,
their ears are kind of they get up right in front of the stage and their ears are kind of a little wacky.
Yeah.
It's unfortunate. I've been blaring headphones in my ears for over 50 years. I'm lucky that I can hear.
Yeah, so we have a hearing benefit where you can get a hearing exam, and then there is assistance with hearing aids if you need them.
Okay. Great information. And look, I would just advise anybody to stop by here. Is there a phone number people can call? I mean, we're talking about stopping by here, but people always like to have a phone number. Is there a phone number for this? Okay, we're going to get it right now.
Yeah, we'll get them.
But yeah, I mean, look, wherever you are in this whole area, it's Veterans and Causeway. It's the nexus of Metairie. And you can just get off the interstate and come by here to People's Health.
So
okay, here's the number. It's an 800 number, 800-315-8782. 800-315-8782. And they're open here at this Medicare Center from 8 a.m. until 5 p.m. Monday through Friday. It's 3017 Vets, basically at the Causeway, right next to Party City, and Trader Joe's. And look, sometime when you're you're picking up something at Trader Joe's, just pop over here and get some information, because this is vital information for people, and a lot of people are spending money they don't have to spend, and they could save money by being on the People's Health Plan.
That is very true.
Yeah,
very true.
All right, cool. Okay? Let's go. We'll take a couple of calls. Reg in Marrero, you're on WWL. Hey, Reg.
Hey, how you doing?
Good, Reg.
Good. I'm 65 years old. I got Part A for the Medicaid, but I'm still working. I haven't retired yet, and I'm being told I need to get Part B. I also want to be penalized for it. Could you help me explain that to me, if you don't mind, in a few seconds you have?
Yeah, sure, I'll be happy to. So let me one question. You have work insurance, correct?
Correct. Yeah, correct.
Okay. So as long as you maintain group insurance, either through you or a spouse, while you're eligible for Medicare, you will not pay a Part B penalty. And then when you retire, make sure you go apply for your Medicare quickly.
Okay. For Part B?
For Part B, right. And ideally you want to start about 3 months in advance of your retirement date.
Okay. Hey, Scoot, let me just say thanks, man. You big old help, man. I love listening to you. You on both sides of the fence, and I really, really respect you and love you for that one. So keep up the good work.
I appreciate it, Reg. You know, we do try to do something a little different here on our show and on WWL, and so it's always nice when somebody recognizes that. So thank you very much. All right. You know, it was an interesting question from Reg. I know a lot of people have those kind of questions. And again, boom, if you can't call or text in, just stop by and ask the questions.
Yeah, that's the number one question we get a lot. Well, not the number one of the big ones we get, simply because Social Security's moved back the retirement age, and so people are working past the age of 65, so they can get Medicare at 65, but they can't really draw their full retirement until after 65.
I see.
So.
Yeah, so look, this could be a great savings for you. All right, if you want to join us with a comment this afternoon, the Oakland Heart Jewelers Talk and Text line, 504-260-1870. We'll get back to more, and I want to continue the conversation about baby boomers and what they contributed to pop culture and to American society. Mike, your thoughts on what baby boomers have contributed?
Oh, man, I told you, the big music festivals.
I know. And
that's
I just, in August, I'm talking about the anniversary of Woodstock, 1969, and then Woodstock was August 15th, started August 15th, 1969, and then Labor Day weekend, 2 weeks after that, was the New Orleans Pop Festival in Gonzales, and a lot of those bands there came here and played, and that was the first pop festival I went to, and I got so drunk on Jim Beam and Fresca that I don't remember everything. Janis Joplin woke me out of my drunken stupor when she came on stage. I finally, regained consciousness. But to this day, I can't touch Fresca or Jim Beam.
Probably for the better.
Oh, yeah. No question about it. I mean, we all, it's amazing. You could get drunk on one thing, and then the rest of your life, it's like, no, I'm not touching this. Not touching this. Mike Knight, thanks for your time.
Absolutely. Thanks for having us.
All right. Time.
Absolutely. Thanks for having us.
All right. Time.
Absolutely. Thanks for